Hi, my name's Dr. Sridatta and I'm a consultant obstetrician and gynaecologist in London. I'm also an ambassador for the British Medical Association Research Foundation. Over the next few minutes, I'm going to take a look at the different types of contraception that are out there and the types of things you may need to consider to find which is the best type of contraception for you. So the first thing to say is that there are approximately 15 different types of method of contraception to use. Some of them are permanent, for example, sterilisation or vasectomy, but most of them are reversible, so you can stop using them and become pregnant pretty quickly. The most common methods of contraception to consider include using condoms or the oral contraceptive pill. But if you're looking for something a little bit more long term, then yes, something like a coil which sits inside your womb, the implant or an injection may be better suited for you. As I said earlier, if you're looking for permanent contraception, then yes, you're looking at sterilisation or a vasectomy. So contraception is free on the NHS and you can either get the contraception of your choice through your GP or by attending a sexual health clinic. One of the key factors to remember when you're considering the type of contraception you're using is that the only way to protect yourself from sexually transmitted infections is to use barrier contraception. So regardless of whether you're using a different type of contraception already, if you're not using condoms, which are the key way of using barrier contraception, then you may get a sexually transmitted infection. So one of the most common questions I get asked is, what is the most effective type of contraceptive? And really the first thing to say is any type of contraceptive is only as effective as it can be if you're using it properly. But assuming that this is the case, the types that have got the best effectiveness, so over 99%, are the injection, the implant, the coil, and of course the permanent methods of contraception, so vasectomy or sterilisation. It's important to remember, as I said earlier, that you still do need to use condoms or barrier contraception with these methods to prevent sexually transmitted infections. So although they're really good at preventing pregnancy, they're not so good at preventing sexually transmitted infections. What about the pill? Well, that's pretty good, but you have to remember to take it every day, roughly at about the same time, if you can. So the key point here is to choose a type of contraceptive that fits into your lifestyle. In terms of looking at the types of contraceptives that are over 99% effective if used correctly, the key ones are the implant, the injection, but also the coil. In addition to that, sterilisation and vasectomy, the permanent methods of contraception, are also over 99% effective. Closely followed behind, though, are the different types of contraceptive pill. So it's really key to make sure that you're using any method of contraception effectively for it to prevent pregnancy. So when would you choose the pill over something like the coil? Well, if you're a really organised person who's got a pretty stable lifestyle, then the pill may be suitable for you, as long as you can remember to take it every day at relatively the same time where possible. If, however, you don't like taking pills every day, it might be worth looking at a different form of contraception, ranging from the implant right up to the coil, which can last 5 years. We have a separate video that looks at the coil, which goes through the different types of coil contraception in a bit more detail. That might be helpful. Now, some people would prefer to use contraception that only is needed to be used during sex. So that would limit you to things like the condom, the cap, or the female femidon. If, however, you prefer longer term contraceptives, then again, it's worth looking at things like the implant or the coil. So some contraceptives can also affect your periods, so that's something to bear in mind if you have problematic periods to begin with. So for example, if you have heavy periods, then taking the oral contraceptive pill may actually reduce the heaviness and any pain that you experience during your period. By comparison, the copper coil may actually make them heavier. So it's worth thinking about your periods and how heavy they are before you consider the type of contraception that you'd like to explore. What about if you smoke? Well, smokers, generally speaking, can use any type of contraception, but as we get older, then it becomes more important to look at the type of contraception we're using. So anyone over the age of 35 who smokes will have a more limited range of contraception. They may be advised, for example, to look at the progesterone-only pill rather than the pill that's got both estrogen and progesterone within it. What about weight? Well, actually, weight doesn't impact tremendously on the type of contraception that you have on offer. So from that perspective, it shouldn't really affect the type of contraception you consider. A lot of people worry about whether they'll gain weight on the oral contraceptive pill, but generally speaking, if there is any weight gain, it may be related to water retention and is usually transient. So we've looked at the implications of smoking and the different types of contraceptives that are available, and we've also considered the impact of being overweight or underweight on the different types of contraception. But what about if you have any medical problems? For example, if your thyroid isn't working properly, or if you're known to have high blood pressure. Well, these are things that you'll have to discuss with your doctor to make sure that you choose an appropriate type of contraception that works with the problem that you have already. So that's really important to go and speak to your doctor about before you decide definitively what type of contraceptive to use. The other factor to consider is that some methods of contraception do include hormones. For example, as the name suggests, the contraceptive pill or the progesterone-only pill. Some types of coil also incorporate hormones. So this is something to consider when you're speaking to your doctor about the types of contraceptive that would suit you. The side effects from these types of contraceptives can really vary from individual to individual. And just remember that even within the groups of pill, there are different types of formulations and preparations that are available, and one might be better suited to you than another. You may have to experiment for a few months to find the perfect form of pill contraception for you. What about if you want to get pregnant? Well, most forms of contraception are reversible, so as soon as you stop them, you have a good chance of getting pregnant. The exception is, of course, if you've gone for a permanent form of contraception, such as vasectomy or sterilisation. But what about things like the implant or, in fact, the copper coil? Well, as soon as the implant or copper coil is removed, your chances of becoming pregnant return to baseline. So it's really important, if you're not thinking of becoming pregnant, to look at an alternative form of contraception. One of the key questions I get asked about stopping the contraceptive pill is how quickly will my periods return? And to a certain extent, it really varies. It depends on, for example, how long you've been on the oral contraceptive pill and whether you had a regular menstrual cycle before you started the contraceptive pill. Usually within a couple of months, normal periods will return, but it can take up to a year. So bear that in mind when you're thinking about when to stop your contraception. One of the key areas to consider is emergency contraception. And this is the type of contraceptive you can take immediately after unprotected sex. There are two different types of methods that you can use. There's an emergency pill that can be taken within 72 hours or 3 days of unprotected sex. The second method is the coil, and that can be inserted up to 5 days after unprotected sex. So which one's better? Well, the timeframes are key, but as the name suggests, the emergency pill only protects you for that episode of unprotected sex. So if you're thinking of having further unprotected sex, then it's important to make sure you have a regular form of contraception in place. By comparison, once a coil's inserted by a doctor, then that remains in place for up to 5 years and continues to provide contraception throughout. So it really depends on what you're looking for in terms of emergency contraception. The key here, though, is that, again, neither of those methods will prevent you from getting infections. So if that is a key aspect to consider, make sure you're also using barrier contraception. So, just to recap, today we talked about the different types of contraception that are available, how effective they can be, and what to consider when you're looking at which one will best suit you. My name's Dr. Sri Datta, and I hope this has been helpful.